My name is Owen Rogers, and today I will be assessing the 12 cranial nerves on my patient and stating their function, the tests that you do to assess them, and the abnormal or normal properties of those tests. To begin, we'll start off with cranial nerve number 1, which is the olfactory nerve that has to do with smell. So today I will have my patient cover her eyes or close her eyes and have her sniff a candle that she does not know the smell of, and then if it works, she'll know that. Okay, what do you smell?
Pine tree.
Okay, it's pine. Good work. Okay, moving on to cranial nerve number 2, which is your optic nerve. It has to do with your vision and like your visual fields. To do that, I will have my patient look at my pen, have her cover one eye, and let me know when she can see the pen or the tip of it in her peripheral field. Okay.
You can see it?
Can you see it now?
No. Yeah.
Okay, let's see it on.
You can see it there.
Here?
Mm-hmm.
Okay, perfect. So as you can see, she could see through her peripheral vision where the pen was and has control over that nerve. For cranial nerve number 3, we'll do oculomotor, which has control over your eye movement. And to do that, I will have her look at my pen, the tip of my pen again, and I'll be going in an H formation. So keep your head still and follow the pen the best you can. And I'm really paying attention to her pupil and eye movement. Perfect. So she did good on that one as well. Now moving on to cranial nerve number 4, which is your trochlear. Its function is down and inward eye movement. So once again, I'll have my patient look at the tip of my pen, and I'm going to move it down and inward. Okay, see it? Can you still see it?
Mm-hmm.
Okay. So once again, she passed being able to look down and in and see the tip of the pen. Moving on to cranial nerve number 5, which is the trigeminal cranial nerve. And I will touch her face a little bit on her cheeks and on her forehead and nose and see if she can sense that at all, because it is a sensory nerve, but also there is a motor component as well. I'll have my patient try to quench her masseter or her jaws, and if she is able to quench them, then that one is functioning properly as well. Can you feel that?
Mm-hmm.
Feel that?
Mm-hmm. Yep.
Okay, now we'll move on to your jaws. Okay, now tighten your jaws. Okay, so I can feel the left one. Can you? Okay, so for some reason, her right masseter is able to squeeze, but her left one is not. So it seems like we have something going on there. We'll see if any of the other nerves down the line are having some asymmetric deformities as well. Moving on to cranial nerve number 6 is the abducens nerve, which has lateral eye movement. So for this one, I will have my patient look side to side without moving her head at all. And if she can do that, she can abduct your eyes normally. So I'll have you follow the pen once again. It's just easier. Okay, perfect. Past that one. She's been all clear with the eyes so far. And now we'll move on to cranial nerve number 7, which is the facial cranial nerve. Its function is facial expression and taste. And for this one, I'm going to have my patient puff her cheeks, raise her eyebrows. What else? Oh, close your eyes tight, and we'll see if you can do and smile as well. So let's start off with a smile. Okay. Let's start off with, or let's go to raise your eyebrows. Okay. Let's go to close your eyes. Okay. And do we do puff your cheeks? Let's do that one. Okay. So it seems as if she can't move her left side once again. I'm pretty sure it was your left side in the other one. So seems like her left side with the trigeminal and now the facial is being a little like misfiring. The nerve isn't totally functioning. That could be because of a medical history as a stroke or something, because it's asymmetrical. But we'll keep moving on and testing our cranial nerves. So now we're going to go to cranial nerve number 8, vestibulocochlear, which has to do, its functions deal with hearing and balance. So you can test this one in a few different ways. I know you can have them be on one foot to test their balance and things like that. But I'm also going to just rub the back of her ear and see if she can hear or feel that on both ears. Actually hear it, obviously not. Can you hear that?
Mhm.
Okay. Can you hear that? Yeah. Okay. So she's able to hear both of those, so her vestibulocochlear cranial nerve is functioning properly. Moving on to cranial nerve number 9. That's your glossopharyngeal cranial nerve. It has to do with taste, your gag reflex, your ability to swallow. So today, for the test, I will have my patient, I'm going to touch the back of her tongue with her toothbrush, since I don't have a palpating stick, and then we'll see if there's a gag reflex or anything like that. And also you can have them swallow. Okay, open up wide, please. Say ah. Okay. So her gag reflex is working. Okay, perfect. You passed that one. Okay, going on to cranial nerve number 10, your vagus nerve. This nerve is a big nerve throughout your body. Helps with lots of different things, but to test its function, I'm just gonna have you swallow. You can do a couple different things, but I do want to look inside your mouth again with a light. Let's see here. Can you open up, please? Okay. Now, can you just swallow? Perfect. So, everything inside her mouth looks good. Her uvula, her tongue, and I did hear an audible swallow. So, that nerve seems to be working good as well and functioning. Okay, moving on to cranial nerve number 11, which is the spinal accessory nerve, also a bigger one. So for this one, I'm going to have you stand up. Let's face this so they can kind of see. And we're going to have you shrug your shoulders up and down. Okay, that's already good. And then I'm going to can you try to twist your head, your neck against my hand. Okay, perfect. So that nerve seems to be firing and functioning properly as well. And to close out, we will go to the hypoglossal cranial nerve number 12. And this one is pretty simple. It's just tongue movement. And she'll stick out her tongue, and I'll have her move her tongue from side to side. Okay, stick out your tongue for me, please. And then can you move it from side to side? Okay, perfect. So that is how you perform an assessment on all 12 cranial nerves and assess their function. And as you do these tests, there's multiple different ways you can do all the tests for the various cranial nerves, but try to pay attention to the abnormalities and if they have any difficulty with certain ones that could correlate, like she did today, being on her left side. But thank you for watching.